Hi, everybody. I hope you can hear me okay. For those of you who don't know me, my name is Anna. I manage adult programming for the Lake Bluff Library. Tonight, Carrie is going to be teaching us about how to get ready for healthcare costs during retirement. And if you enjoy her program, we hope you will come see us again. We've got programs coming up next week on how to organize with ADHD, try to get your home a little more organized for everyone, not just those with ADHD, because we all know when you're running out of the house and can't find your keys, you're going to be late. So tonight's program will be recorded, and we will post that on our Lake Bluff Library YouTube page, and I'll be sure to send the link out to the registered people once that's available. Give us a couple days to get it up there. Carrie will be asking you guys some questions throughout the program, so you do have the ability to turn yourselves off mute if you would like to answer that way, or you can post in the chat and I will call out to Carrie how many have responded. All right, I'm gonna let Carrie take it from here. Thank you, everyone.
Speaking of ADHD, my name is Carrie Espinosa. It's a pleasure to be here with everyone tonight, and thank you for showing up. I've been in the insurance industry since 2003, and started when I was 12, in case anybody's wondering. I love what I do. It's not just what I do, it's who I am. And I've been fortunate to build a nice career and a nice agency and be able to help a lot of people navigate their healthcare costs, either from an employee benefits perspective or from a Medicare perspective or anything in between. So tonight I'll be sharing some of that with you. And I have to tell you, my grandmother is super proud of me. When I was a little girl, I wanted to grow up and be an ice cream truck driver. And I exceeded my own expectations. So we'll get into today's presentation and planning for healthcare costs in retirement. So on the next slide, you'll see a picture of my team. I'm only as good as the people I'm surrounded by. So on the screen, you'll see myself in the middle, and then to the left is Kristen Herrera, and to the right is Vanessa Soberanes. And Kristen's been with me for almost 6 years. Vanessa's been with me for going on 2, and we are the terrific trifecta. So like I said, we serve clients from hire to retire, and that means we work with employers with employee benefits. We help folks navigate their Medicare insurance. When I'm doing that, I'm usually wearing my Medicare cape. And then individual health insurance or Affordable Care Act coverage. So we're going to talk about what that all looks like as we journey through life. So everybody remembers the game of life, right? When playing, oh, sorry, let me give you my official disclaimer. I forgot about that. I have to tell you what I'm going to be presenting today is for informational purposes only. I can't give legal or tax advice. We're going to touch on some of those topics, but everything that we're going to talk about today is for informational purposes only. So let's go on to the next slide. And this is sort of the life journey, right? We go from our 20s to our 30s, 40s, 50s, and 60s, and hopefully win the prize. I don't know about you guys, but I'm thinking back to my 20s and I thought, boy, I knew so much. Did anybody else feel that way? Yeah, it's amazing how little humility goes a long way as we get older, right? So, you know, we're likely already in our 20s to be working. Maybe we've started our first job or we've started a family. Maybe we're finishing college. Maybe it's all of those things, right? We may buy our first house. And then before we know it, we're in our 30s and heading into our 40s. In our 30s, we probably have moved up the career ladder a little bit. We've maybe upgraded to a larger house to accommodate our 2.5 kids and our family pets. I'm obviously joking. Some of us have more and fewer kids and some not at all, right? Maybe you were coaching your kids' sports teams or just cheering them along from the sidelines. In our 30s, life was really busy, but it was good, right? As we go into our 40s, we're wondering, this Rod Stewart song, Forever Young, who does that really apply to? Because I'm not staying forever young, right? In our 40s, we probably had our first routine colonoscopy. We may be experiencing some minor aches and pains. Somebody may use the word arthritis with you. We're aware of our health, but it's really not an issue yet, right? We're scheduling our appointments around our kids' schedules or maybe even our parents' appointments. And our parents may have long-term care needs. We're suddenly aware of this risk, but we're not really ready to start that planning for ourselves yet, or at least we don't think we need to yet. In our 50s and 60s, we may see a clear path to retirement, or we may be trying to catch up. Retirement doesn't mean for us what it meant for our parents, because we did live through the 70s, right? We are, or we're likely making good money and considering how to create income from our investments. Before we get started today, I had the pleasure of talking with one of the attendees, Julie, and we were just talking about that very topic. Financial goals change dramatically in our 50s and 60s from years prior. If we're a typical patient, we're on at least one statin and a high blood pressure medication, maybe even more, right? And at this stage of the life, we're beginning to see that there's this thing called retirement, not too far ahead. My goal today is to help you see what retirement planning looks like, but more importantly, what the healthcare component and planning process looks like with retirement. So when thinking about retirement, there's really smart people who've gone down this road before us, and there's things that they say that they wish they had done differently or wish they'd been aware of. So we're going to start with the importance of financial and estate planning. And I'm going to reference a US News article by Drew Parker. Drew is a retired financial manager for a Fortune 500 company in Mercer Island, Washington. He says he wishes he had made a more detailed financial plan before retirement. He says what he knows now would have been exponentially more valuable at a younger age. He encourages his clients to have due diligence and to create their own comprehensive financial plan based on their unique needs and circumstances. Obviously, he does that with them, right? When you think about retirement, what are your retirement goals? What do you want to be doing? Do you want to be spending your days with your grandkids, golfing, traveling, volunteering, working part-time? Maybe a little bit of everything, right? Medicare begins at age 65, but some people don't get their full Social Security benefit until later. So it's important to keep that in mind, that if you retire early, you may not be able to have health insurance or know how to navigate your health insurance. You won't have it through your employer. It's also important to know that when you retire early, guess what? Your friends may not be alongside of you, right? If you're fortunate enough and you've been diligent and saved your money, you may be retiring and your friends are still working. Remember when you were a kid and you'd call your friends, hey, you want to go outside and play? Now your friends are saying, no, I have to work. Yep. So the other thing is to plan for a slower pace and be okay with it. For some people, that's very easy. For other people, maybe not so much. All along, we've been doing what we were supposed to be doing, and the thought of doing what we want to do is exciting. But we have to remind ourselves also it's okay to take our time while we're doing it. And then the healthcare planning piece, right? Some risks in life are less manageable, and healthcare is one of those. So having healthcare planning be a key part or key component of your retirement planning is important. Leaving behind a steady paycheck to retire is a big risk. You want to be prepared for that. And I want to reference another bit of financial advice from Dirk Cotton, who's a retired executive in Chapel Hill, North Carolina. And Dirk says that retirement planning is more risk management than portfolio management, although portfolio management seems to get all the press. So what he's saying is that managing your money gets all of the attention, but managing your risk, right, is equally as important. He goes on to say that for him, focusing his retirement decision primarily on investing drew attention away from some of the other risks, like family members who might need support, financial support or other support, and then healthcare shocks. The key is to have a financial plan and to enjoy your retirement and to take into account healthcare costs, whatever that looks like for you. And you can see here the most common financial surprise for retirees is inflation and unexpected medical expenses. So when you think about the game of life, right, there's some key ages and dates in your timeline that you want to be aware of. And the actual game of life doesn't have the age 62 and 65 signs. I've added those because I think they're really important. When you think of age 62, you think of receiving Social Security, but maybe not, right? You can receive your Social Security retirement benefits as early as age 62, but you're not yet entitled to your full benefit. So many people delay their retirement, their Social Security benefit until they get older. You can take it anywhere from age 62 to age 70. And when you delay after your natural retirement age, it actually goes up quite a bit. I believe it's 8% every year. And guess what? That's a good return, right? I'm not giving financial advice. That's not my thing, but I do want you to be aware of that. The other age is age 65, and that's when you're in your Medicare initial eligibility period. That doesn't necessarily mean you want to enroll in Medicare, but it means that it's an option. It's a new option on the table. If you're still working, please carefully consider whether or not you want to enroll in Medicare. If you're not working, you're probably going to want to enroll in Medicare. And your initial eligibility period starts 3 months before the month in which you turn 65, includes the month in which you turn 65, and 3 months after. However, a couple of things to know, there's a couple caveats to this. If you turn 65, like right now I'm working with a client who turned 65 on December 1st, there's a rule with Medicare that says her Medicare actually starts November 1st. So if your birthday is on the 1st of a month, your Medicare will start a month prior. And again, the other thing to keep in mind with turning 65, if you're still working, there's all these different rules with employer plans and whether Medicare is going to be a primary payer or a secondary payer. If you have other group health coverage, you can delay Medicare without penalty. However, if you work for a very small company, that may not work for you from a claims perspective. So I always encourage my clients to, let me kind of dive into their specific details. If you're working with someone, that's great. If you're not and you're turning 65 and still working, I highly encourage you to consider that. And next, let's talk about what to know if you're retiring early, right? So let's say that you're going to retire before age 65. And I've been fortunate to help a lot of clients navigate this before they're 65, what their health insurance options look like. The first and most important thing to know is, number one, employer coverage is usually subsidized by your employer. So what does that mean? That means that, let's say your premium is $500 a month. Your employer is probably paying the big majority of that, and you're actually contributing a small fraction or small portion relative to the total cost. Well, guess what happens when you stop working? You're eligible for COBRA, but you're going to pay 100% of the cost, if not a little bit more. 102% is what's allowed, but your costs are going to go up exponentially. So my favorite thing is when somebody's contemplating retirement, having these conversations and sort of prepping them instead of the call that says, hey, Carrie, I'm going to retire next month. What do I need to do? And I'm like, well, you should have called me 3 months ago or 6 months ago. And your initial shock when you see the COBRA premium may be, good grief, good gravy, right? That's really expensive. That's true. COBRA pricing may appear to be expensive, but relative to other options, it may be the best value. You also want to consider, where are you at with regard to your deductible for the year? If somebody's retiring now and they've satisfied their deductible or their maximum out of pocket, even if their COBRA is $600, $700, $800, I might say, boy, at least for the balance of this year, let's ride that out. The other option is option number 3, which is a plan through the Affordable Care Act. The Affordable Care Act, by the way, is also called Obamacare. And the Affordable Care Act allows you to buy insurance on the individual market. When I say individual, I mean family too. You can go out and get an individual health insurance plan. And some people pay lower premiums. You qualify for premium subsidies based on your age, your household size, and your income. It's really quite a dangerous game if you don't know what you're doing. So you want to make sure you know how to do this and to do it right. And we're going to talk a little bit more about that next. So as a matter of perspective, With the Affordable Care Act plans, and again, I have extensive experience helping people be strategic about this. The first thing you're probably catching is these prices, right? And you're like, that's a lot of money. Know that these are full price sample rates and they're for informational purposes only. These rates specifically are for a 60-year-old living in Lake County, Illinois. Rates do vary based on your county, based on your state. These are just sample rates. So when shopping for individual health insurance, there's different metal levels. That's where you see the bronze, silver, gold, and platinum. And it's important to know that with the bronze plans, you pay a lower monthly premium, but you pay a higher spend when you're using your health care. Bronze plan deductibles are the amount, deductibles, by the way, are the amount that you usually pay yourself before the insurance plan starts to pay, can be thousands of dollars every year. I think this year our deductibles in the bronze level plans are upwards of $7,000. So when you're working for an employer, you have access to gourmet health insurance because it's on a group basis. Your employer is sponsoring something that's unique to being part of an employer group. When you're shopping for yourself, it's a whole different game. Then you have silver level plans where you pay a higher monthly premium, but when you use your insurance, you might have lower co-payments or lower out-of-pocket costs. And the same is true for gold. The other thing to know about navigating the individual health insurance market is that the networks that you're used to with your employer plan are going to be much different than what you have here as an option. And specifically, what I mean by that is it's kind of like saying, hey, I want to go get a cup of coffee. Take me shopping, go get me a cup of coffee and I want Starbucks. And I'm saying, no, we're going to go to McCafe. When I get executives, especially who are retiring before age 65, and they're calling me saying, Carrie, I heard you can help me navigate this, help me understand my options. My first question is, let me get some information on your household, your income, all of that, because I want to give you the best rate possible and help you maximize any premium assistance. And then we look at plans and it never fails that the executive is like, well, this is baloney. This isn't what I want. I'm like, I know, but I'm not going to give you what you want today. So let's just get the expectations laid out there and help you understand what this looks like. The other thing to know about individual health insurance plans is while you might have co-payments for things like office visits and specialist visits, prescription drugs are almost always subject to the deductible. And that's a real stinker if you're on an expensive medication, right? So what we do with our clients is we do a little extensive planning and I'll say, hey, you can get this prescription through GoodRx at a fraction of the cost that it would otherwise be. So again, with the Affordable Care Act, your rates are based on your age, your household size, and your income. Folks, this is a game. My job, if you work with me or if you work with another broker, is to help you beat this game. The most important thing to know about all of this is, because I've had people do this, tell me, oh, my income, I'm a single person, my income is only $20,000 a year. I say, great, what's your zip code? They give me their zip code and I'm looking at them like, there's no way you could pay your taxes, in Illinois at least, on that kind of income. And they say, no, that's my income. So they get a premium subsidy. Then when they go to file their taxes the next year, guess what? They made like 120,000 and they have to pay back all of that premium assistance. So know that this truly is a game, but being on target with your income estimates and knowing how to plan for it is going to be key to your success. And then next, let's talk about health savings accounts. And I'm a big fan of health savings accounts. I have both professional and personal experience working with them. If you've not heard of a health savings account, it's a special account, kind of like a personal checking or savings account, but the money you put into it is only to be used for healthcare expenses. Whether you have an HSA on your own or through an employer, you own that money, not the insurance company, not the employer, you do. So whatever contributions are put in there, that's your money and it rolls over every year that you don't use it. Actually, on the way here, I was having a conversation with somebody about health savings accounts, and we were talking specifically about this triple tax advantage. Again, I'm not able to give tax advice, but I can tell you based on my experience. Here's what you want to know about health savings accounts. You can contribute dollars on a pre-tax basis. So the money you put in is tax-free. The earnings are not taxed. And then when you take money out or in retirement, the money comes out tax-free. So that's what they mean when they say a triple tax advantage. It's also important to know that a health savings account is different than a health reimbursement arrangement, which is an HRA. It's different than a flexible spending account, which is an FSA. An HSA is unique in and of itself. So a lot of times I'll help somebody with their planning and they tell me, oh yeah, my employer has this tax-free account. And I say, okay, well, what kind of tax-free account is it? Because there's a lot of options there. The other thing to know about health savings account is the money that you put in there can be earmarked for future healthcare needs. So specifically, it can help bridge the gap to Medicare, meaning help you pay for those high deductibles with the Affordable Care Act or other healthcare costs. You can also use it when you're 65 to pay some of your Medicare premiums, specifically your Medicare Parts B and D. And then most importantly, your long-term care expenses. And we're going to talk more about all of that fun detail with long-term care planning in just a little bit. So on this next slide, let's talk about healthcare planning for someone who's 65 and older or coming into Medicare. Is anybody shocked by this number? A 65-year-old couple leaving the workforce today can expect to spend $300,000 in healthcare and medical expenses through retirement. Why don't they tell us this when we're 20, when we're 30? Good gravy, this is a lot of money, right? Well, maybe you have it under your mattress. I don't. And healthcare is one of your largest expenses next to housing and transportation costs. That's insane. It's also one of your biggest variables. So that $130,000 is comprised of $140,000 for men and $160,000 for women. Do you know why it's more expensive for women? Yep, because we live longer. We take better care of ourselves, gentlemen. So we typically live longer. And it's really hard to estimate. So know that it's hard to estimate healthcare costs because averages can be very misleading. If you ever call around to shop for a healthcare service, it varies based on the type of facility that you go to. It's based on your geographic location. There's so many variables. I don't want to say it's a shell game, but it's definitely a complex system. And then keep in mind that that $300,000 estimate does not include any long-term care costs, any dental or Medicare surcharges for B or D that high income earners have to pay. And we'll talk about that as well. So what is included in that $300,000 price tag? Good question. The first thing is your Medicare Part B premiums, which, by the way, does anybody know how much that is this year? So Medicare Part B is $203. That's your, I'm sorry, $148.50. That's your premium for Medicare Part B. The deductible is $203. It doesn't include Medicare supplement insurance. It doesn't include Medicare Part D, nor does it include Medicare Advantage or out-of-pocket costs. And I really like to emphasize over here on this Part D, these prescription drug costs are your biggest variable. And know that this is the most complicated product that as a retiree, if you're on Medicare, when you purchase your Medicare Part D plan, it's got the most variables in it and it can really vary, your cost can vary greatly from one plan to the next. Medicare Part D, by the way, can be part of your Medicare Advantage plan or it could be a standalone benefit. So we've talked about what's included with this $300,000 price tag. Let's talk about some of those other items now. And we're going to talk first. Well, actually, let me give you an overview on Medicare. So if this is what everybody's been waiting for, here we go. Let's do a little stretch. All right, so we're going to start here in the middle. Original Medicare is your Medicare Parts A and B. And I've already alluded to there being a premium for Part B, but let's start with Part A. Medicare Part A, you pay into while you're working. You pay it in payroll taxes. Your employer also contributes towards the cost of your Medicare Part A. That's funded through the Medicare Trust Fund. Medicare Part A is what covers inpatient hospital, skilled nursing, and other inpatient services. Medicare Part B is what covers your doctor visits and other outpatient services. You pay a monthly premium for Medicare Part B. Today, in 2021, the standard premium for Medicare Part B is $148.50. Higher income earners pay more, and we'll talk about what that looks like. So Medicare A and B together are represented with your red, white, and blue card. And hopefully everybody's seen that or is familiar with what that means. You might be on this webinar for yourself. You might be on it for a friend or for your parents. That red, white, and blue card is really important. Make sure you don't lose it. If you do, you can request another one, but it's important to have that. So Medicare covers some, but not all of the out-of-pocket costs with your healthcare and retirement. It's got a lot of benefits, but there's deductibles, co-payments, and co-insurance. I tell my clients, when you look at your Medicare card, look at it and think of a piece of Swiss cheese. And the holes in the cheese represent your deductibles, your co-payments, and your co-insurance. So from there, you decide, do you want to get other insurance? If so, what does that look like? And know that this scenario that we're going to go through is really intended for people who are 65 on Medicare without a retiree benefit from their employer. If you have a retiree benefit from your employer, there's a little different conversation to be had. This is intended for people who don't have access to something like that. So Medicare supplement plans, the option over there on the far right, is what you can use, because they're also called Medigap plans, to cover those gaps in your original Medicare. Medicare supplement plans are standardized according to their letter. You pay a monthly premium, and then you pay little to no out-of-pocket costs based on which plan you have and what you decide to do with regards to that coverage. Medicare supplement plans do not include prescription drug coverage, so you want to consider a standalone Medicare Part D or Medicare prescription drug plan. Again, over there, you pay a monthly premium and you have predictable out-of-pocket costs. The other option is this option right here, which is Medicare Advantage. And with Medicare Advantage, you have a private health insurance company managing your A, your B, and your D benefits. They put it all in one plan. So Medicare Advantage is also called Medicare Part C, and they're typically little to no monthly premium, and you pay as you go. You have co-payments when you use services up to an out-of-pocket maximum, kind of like you did when you were working, right? And then Medicare Advantage plans often include prescription drug coverage or Medicare Part D. Now, if you're a veteran and you're using the VA for meds, you might not want one that includes drug coverage. You may not. It all depends on your situation. What's enticing about Medicare Advantage plans is that they include these additional benefits. Additional benefits can be things like vision, hearing, dental. Although if you've been watching the news lately, there's a new proposal for a human infrastructure benefit with Medicare that would include some dental, vision, and hearing to original Medicare. But right now, because nothing's been finalized with that, right now the only way to get those benefits as part of your plan is to have a Medicare Advantage plan. So on the next slide, we're going to do a side-by-side comparison, because this is always very confusing to folks. And truth be told, if I wasn't doing this as long as I've been doing it, it would be very confusing to me as well. So let's look at some features or some goals, some values that we might have with regards to our healthcare and how they work under a Medicare supplement versus Medicare Advantage plan. The first thing to know is when it comes to doctors and hospitals, with a Medicare supplement, you can go to any doctor or hospital that accepts Medicare. So long as the provider accepts Medicare, they're going to accept your supplement. And that's true whether you have a supplement through company A, company B, company C, whatever. With a Medicare Advantage plan, you may be required to use doctors and hospitals that are in the plan network. Medicare Advantage plans can be HMO, PPO. There's a lot of different varieties. And it's important to know if you're going the route of a Medicare Advantage plan, what doctors and hospitals do you have access to as part of the network. Remember how I talked about that with the Obamacare plans or the Affordable Care Act plans? Your access to see the doctors and hospitals that you want to see is very important. The next thing is with referrals. On a Medicare supplement plan, you can see specialists without referrals. With a Medicare Advantage plan, you may need referrals to see specialists, especially if you have an HMO. If you have a PPO, you won't need referrals, but you still want to make sure your provider is a network. And if you're wondering what's all this talk about network, network is the doctors and hospitals that you have access to as part of the contract with the insurance company. With a supplement, there's no network restrictions and coverage travels with you across the US. So if you have a supplement and you're living in Illinois, but you're snowbirding in Arizona or Florida or wherever, that coverage travels with you. You don't have to worry about, can I see the doctor where we're going? With a Medicare Advantage plan, you may have network restrictions. Emergency care is going to be covered regardless of where you travel within the US, even sometimes abroad, but you may not have access to see doctors and hospitals in other states. If you're going to be snowbirding, that's really important to know up front. And a lot of the PPO Medicare Advantage plans do have broad network access, but again, you want to dot those I's and cross those T's before you make a decision. When you're enrolling in coverage, you can buy a Medicare supplement plan anytime after you turn 65 and join Medicare Part B. Here's the rule though, with a Medicare supplement plan, if you're within 6 months of that, you don't have to answer any medical questions. If it's been a year since you've had a Medicare supplement plan or you've had Medicare A and B and now you want a supplement and it's been an extended period of time, more than 6 months, the insurance company can ask medical questions to determine your eligibility and your rate. Also, with Medicare Advantage plan, it's important to know that there's specific periods when you can enroll in those. So when you're first eligible, it follows that same Medicare eligibility period, the month you turn 65, 3 months before, 3 months after. There's also specific periods during the year, which we're coming up to, the annual enrollment period, AEP, October 15th to December 7th, when if you're on a Medicare supplement, you can now enroll in a Medicare Advantage plan, or if you're in a Medicare Advantage plan, you can make a change to another plan. When it comes to costs with a Medicare supplement and drug plan, you're going to pay a monthly premium in addition to your Part B premium, right? When you use services, your out-of-pocket costs are limited. With a Medicare Advantage plan, you generally pay 0 or low monthly premium in addition to your Part B premium. And when you use services, there's co-insurance, co-pays, deductibles, etc. And again, with the supplement, you want to consider a standalone Medicare prescription drug plan. With a Medicare Advantage plan, it's probably going to be embedded. It's really important if you're newly eligible for Medicare, you don't have other creditable drug coverage, meaning you're not working, you don't have VA coverage, you don't have a state pharmaceutical assistance program. You want to take Medicare Part D, even if you're not on prescription drugs. You want to buy that coverage either as part of an Advantage plan or a standalone, because if you want to get it later, guess what? There's a penalty. That's also true with Medicare Part B if you don't enroll in that timely. So know that original Medicare pays for much, but not all of your healthcare services and supplies. I do have clients who have come to me in their 70s who didn't take other coverage. I encourage people when they're reaching out to me the first time they're eligible for Medicare to consider the additional coverage at that time. And it's important to choose the right insurance plan that meets your needs. And know that as I say that, I know nobody's ever talked to us or told us that before, but it's really important to understand your needs. So on the next slide, we're going to talk about that IRMA surcharge that I alluded to. IRMA stands for Income Related Monthly Adjustment Amount. And I have to tell you, there's nothing more not fun than meeting with a client whose name is Irma and having to talk about this. Hopefully there's no Irmas online. This is true for today. This is 2021 data. Next year, this is all going to change, which, by the way, I didn't say this, but that Medicare Part B premium and the deductibles, all of that is going to change next year as well. But today, a beneficiary who files an individual income tax return at 88,000 a year or less pays that standard Medicare premium, 148.50. Medicare beneficiaries who file a joint income tax return, husband and wife, 176,000 or less are paying 148.50 per person, right? The thing is that Social Security is looking back 2 years at your income to make this determination. So I've had situations, right, where a client comes to me and yeah, they're well under this today, but guess what? They sold a building last year. They inherited a building, or they just quit working. There are ways to appeal these IRMA surcharges, and you can find how to do that online through your insurance professional or financial advisor. Here's what's a real stinker is when you've got people who have really high income and look at their Medicare Part B premiums, and that surcharge also applies to their prescription drug coverage. I mean, don't get me wrong, it's a good problem to have, but sometimes having these conversations with an insurance professional and or financial advisor or planner prior to retirement can help you plan a little bit more effectively for this. And this is a big reason too, let me just say why. If you're still working, you may or may not want to take Medicare. If you're still working and you have access to employer coverage, you can delay your Part B without penalty. If you're over here on one of these higher income tax, higher penalty brackets, why would you pay more? You don't have to. So that's IRMA. Next up is going to be talking about what Medicare doesn't cover, because I think it's important in setting expectations with you or with other clients. I think it's important to know what does Medicare cover, but equally, what does it not cover? So Medicare does not cover most prescriptions. That's why you get a Medicare Part D prescription drug plan. Medicare does not cover routine dental. Medicare does not cover routine hearing or routine podiatry. Medicare does not cover routine vision. However, this is often a misconception with my clients. They'll tell me, oh, but I need to buy a vision insurance plan. And I'm like, well, I'm not sure that you do, but what's your concern? And they say, well, if I have cataracts, I want to make sure I have coverage. Medicare does cover services like cataracts, glaucoma, macular degeneration. That's considered a medical eye need. That's not considered a routine vision need. And while routine vision isn't generally covered if you have diabetes or other health conditions, there's exceptions to every rule, right? The big ticket item, though, that's not covered by Medicare that we're going to talk about next is this long-term care. So let's see. Do you have any idea how expensive or how little cost long-term care is? Do you think it's expensive? All right, let's see. That's how expensive it is, right? You see the people sitting there rolling out the money. And know that these numbers are valid numbers, median, Illinois State, 2020 numbers, but we're not median in this market. If you're up north here in the Chicago market or north of Chicago, know that these numbers are really low relative to what the real costs are. So homemaker services are things like somebody coming in and helping you with your eating, meal prep, maybe dressing, which by the way, let me just define for a minute. Long-term care is something that you need when you can't take care of yourself, right? So there's different levels of service. There's the homemaker services, which are around $4,800. Then there's home health aid services, which are a little bit higher because they have a little bit more medical responsibility. There's also adult daycare, which I quite frankly look forward to someday. I think I'm going to be sitting in a room with my friends, and instead of playing, some crazy Monopoly game, we're going to be popping a balloon around the table and calling it a day. And then we have also assisted living and nursing home care, right? So when you think of getting older, you think of planning for the aging process. Healthcare costs, this is another big ticket item. And this is a big, big variable that can make or break you. I don't know about you, but I couldn't afford to spend $60,000 a year for a weekly home care service. That's 40 hours a week, by the way, 44. I couldn't afford to do that for too long. So let's go to the next slide and just talk about what costs more. We're in the process. What makes me put this up here is I was sitting at a college session with my son. We're doing some college planning. And These are averages. Obviously, they're low averages, right, in both cases. But a year's tuition and fees with room and board at a public 4-year anniversary, the national average is $21,400. Many of you know it's actually more than that. But this again is from educationdata.org. I'm sitting there thinking, good gravy, this is a lot of money. How are we going to afford all this? And then I started thinking to myself, well, Carrie, duh, you do long-term care planning with your clients. How are you going to afford that? Like, this will be a walk in the park relative to the cost of long-term care, right? So 1 year in a nursing home in a private room, the national average is $105,000. If you had to pick one, well, which would you rather choose? I want the 1 year's tuition and fees with this service. Again, I think this is all a matter of perspective, right? And I think that knowing and being aware of these things is really important. So let's talk about how people pay for long-term care services or what their long-term care planning strategy is. And know that a lot of us didn't know to have these conversations 10 years ago, 20 years ago. This is all kind of relatively new for all of us. There's government programs and there's private financing programs. I'm just going to hit on a couple of the government programs because there's a lot of misconceptions. I want to talk about Medicare primarily because a lot of people think, oh, Medicare is going to cover my long-term care needs. And I say, oh boy, I wish that were true. Medicare covers up to 100 days of skilled nursing facility coverage, true, but you also have to be in a rehabilitative stage. I want to tell you a story for a minute about one of my friends. My friend Arlene, her mom retired from the Chicago Police Department. I helped her pick, she had access to a retiree plan, so I can help her enroll in any coverage through me. I helped her pick one of her retiree plans. And I said, you know, do you want to talk about any long-term care planning for mom? And I'm never, ever pushy with anybody, not my customers, not my friends. I'm not that person that you see coming at the party and you want to avoid me. My friend says, no, I'm not really that worried about it. She's got a pension. I said, okay, that's fine. If you change your mind, let me know. Well, this was about 5 years ago that we were having this conversation. I walk every Friday morning down at the beach with my girlfriend, Arlene. And about a year and a half ago, 2 years ago, her mom was treating at cancer treatment centers and wound up over at a facility for wound care. And while she was there for wound care, you know, my friend started to notice some cognitive challenges with mom. And she says, Carrie, have you noticed anything? Because I checked in on her mom one day for her. And I said, yeah, I said, it didn't seem like things were quite all together there. She says, I think I'm going to have her assessed. And I'm like, well, okay, if that's what you think you should do. While mom's in the facility, which is $5,000 to $6,000 a month, right? But Medicare's paying for it for that 100 days because she's rehabilitative. While she's in the facility, mom's diagnosed with early onset dementia. Guess what happens? Medicare stops paying. Guess who has to pay? Either my friend or her mom. And if you've not ever been in that situation, it's a horribly excruciating decision to make. I know mom needs this level of care. Boy, that's a lot of money. Is this what we can afford and how long can we afford that for? So while I still don't push my friends or anybody that I come into contact with, I do share that story because I think being prepared and knowing what to expect is key to success in life and to this. So Medicare is not going to pay for true long-term care where you can't perform 2 of your 6 activities of daily living. Veterans benefits are limited. You have to qualify. And guess what? You're going to a veterans hospital or a veterans facility to receive that long-term care. And Medicaid. If you go on Medicaid, that means you've spent on all your assets. You've private paid. This option over here, you've done your personal funds. You've exhausted all of those. You're going on Medicaid. Well, guess what Medicaid's going to do? They're going to attach themselves to whatever assets you have left. If it's your house, you think you're going to leave your house to your kids, they're going to say, yeah, not so fast. When you pass away, there's this Medicare asset recovery or Medicare investment recovery. Not put a lien on the house. They want to recoup their money. So the ways to finance it is either figure out a way to do it on this side or figure out a way to get onto Medicaid. Private financing is, or I should say veterans benefits too. Private financing is either paying with your personal funds, meaning you have enough money that it's not an issue. If that's the case for you, God bless you, I'm jealous. For most of us, that's not the case. The other way is to get a senior living line of credit, which is a temporary solution to a permanent problem. It'll buy you some time, but you're going to have to pay that back. And guess what? You or your folks or whoever still needs that long-term care. Some people do a life settlement. They have life insurance, and you see commercials for these life settlement companies all the time. They'll buy your life insurance policy. If you sell it when you're healthy, you're in a much better position than if you sell it when you're in a situation like this. Some folks do reverse mortgages. There's mixed bag of emotions on those. Everybody's got different needs, different situations. So I'm not one to say, never say never. But with a reverse mortgage, right, then you're not owning the house. So if you're planning to pass it on as an asset to your son or daughter or niece or nephew or anyone, that's not happening. The other option is long-term care insurance. And I have to tell you, I'm kind of like one of those people who I like to balance risk reward. I've overthought this 150 times. I am a proponent of considering long-term care insurance as part of that strategy, especially if you have private financing options. You can leverage those monies, those resources that you have earmarked for your future long-term care needs. You can leverage them to get more through a long-term care insurance policy. Oh, that's what we talk about right here. So let's just talk about long-term care insurance for a minute. We'll go on to the next slide. And there's different types of long-term care insurance. Think about going to the drive-thru at McDonald's. Do you want a cheeseburger? Do you want a double cheeseburger? Or do you want a Big Mac, right? So there's short-term plans, which are also called home recovery care. Relatively inexpensive, relatively low coverage. Something's better than nothing. I did a quote for a couple today. It was about $1,200 a weekly benefit for up to 52 weeks, home care only. It was estimating about $100 a month. Quite honestly, if I paid $100 a month and got $1,200 a week in benefit, I think that's a good trade. There's traditional long-term care policies where you pay a monthly premium to the insurance company. You pay that, and hopefully in the time that you need that long-term care insurance, you've got a nice pool. You get to draw from that pool. Sometimes there's spousal benefits. Sometimes there's return of premium riders. There's all different ways you can slice this, right? With traditional long-term care, though, it's kind of a use it or lose it sort of thing. So I'll have clients who are, making significant interest on their investments that use some of that interest to fund traditional long-term care, and there's tax advantages to that as well. And then there's the double, the quarter pounder with cheese, or the Big Mac, I should say, the hybrid policies, which are a combination of life insurance or long-term care or annuity and long-term care. And what I like about these is that they're more permanent products that give you much more of a benefit. I kind of like the life long-term care idea, because if you don't need the long-term care, the money you put into it becomes life insurance. Yeah, you miss out on making some extra money off of that. You don't get the interest that you would have had in the stock market. But guess what? You've got really great long-term care coverage. Let me just real quick before we go, these two options cover all of the different care levels of care in the care continuum. So home care, assisted living, assistance in an independent living facility even, skilled nursing facility, memory care. This option up here is going to be home care only. So in closing, here's my thoughts, is you can't make a bad decision by putting some effort into making a good decision, right? So the primary driver in all of these insurance decisions should be affordability. If you can't afford the monthly premium, guess what? It doesn't matter how good the insurance is. Put some thought into this. If you invest as much time into thinking about all of this healthcare planning stuff as you do planning your vacation, right? Which most people sadly don't. But if you put some effort into that, you're not going to make a bad decision. It's the people who don't plan at all that get in a pickle that have to react as opposed to being proactive. Also know that the healthcare landscape is constantly evolving. Knowing how to navigate changes, not just in health insurance, but also in healthcare, is going to be key to your happiness and success. Long-term care is a real risk, a variable one. Remember how we said portfolio management is one thing, risk management is a whole nother thing. This is that risk management. And so when you're preparing or planning your retirement, a solid financial plan takes into account not just the need to plan for your housing and your transportation and all the other fun things, but also your healthcare costs. And with that, I'm just going to share my information and know that I'm happy to be a resource to you. This is a lot. This is everything that I've learned in the last like 15 years, 20 years of doing this. So I don't know, I guess, oh, there we go. So there's my information. I'm Carrie Espinosa. I own Horizon Benefit Services. We serve clients throughout Illinois, Wisconsin. We're licensed in some other states too. Know that if you ever need something, I'm happy to, give you a complimentary 15-minute consult. If I can help you, I will.
All right, so if anybody has any questions for Carrie in the future, feel free to contact me at the library and we can put you guys in touch. And thank you so much, everyone, for joining us tonight. We will have the edited recording up for you guys in the next couple days. It might be Monday. We do take a weekend here. So we'll see you all and have a good night, everyone.